I know that new cases, we have about close to 2,000 new cases coming up, but we also, in regards to deaths, this is something that I didn't really pick up on, but new deaths is close to 100, but for this week alone, we've had 25 deaths. That's accurate?
Yeah, it's been a rough month of August. The Delta surge has really been devastating and deadly in the state of Mississippi. We had over 1,000 deaths in the month of August, and we're going to have a lot more deaths. Yesterday, we reported 102 deaths that had been reported. There's some good news in the sense that it looks like our case numbers are starting to drop, but our case numbers are still very high. Almost 2,000 a day. We know that about 2%, a little bit over 2% of everybody diagnosed with COVID is not going to make it. So expect more and more deaths because it takes a while. The deaths will trail the cases. Hospital situation's been pretty dicey. We are starting to see a small decline in the daily rate of hospitalization, but we're still in effective situation where we have a negative number of ICU beds, right? There's no free ICU space. We're still having to stick people in the emergency room for ICU care. That's going to continue for a while, but hopefully with a lesser number of people coming in the hospital, a little bit of breather on that in coming weeks. But it's been rough. One of the things that we're starting to see, which is really sad and tragic, is we're seeing a lot of pregnant moms not make it. We're aware and are, probably we'll find out more, 8 pregnant moms who died, late in pregnancy so far, in the past several weeks, and not a one of them's vaccinated. We feel very strongly that the data shows that if they'd been vaccinated, they'd have been fine. And those are unnecessary deaths. Just want to reiterate that the COVID vaccines are safe for pregnant women. And it's also safe for breastfeeding women. The OBGYN Society, the societies that are the experts in this strongly support vaccination for pregnant women. The other thing is, we have this thing called the monoclonal antibody treatment. And it's basically, if you get diagnosed with COVID, you can get a shot or an infusion of antibodies to protect you. And that's good for pregnant women too. Everybody needs to consider getting it if you get COVID, but especially pregnant women, because the pregnant women are real high risk for severe disease and death from COVID.
Another group that I'd also like to harp on or shed light on in regards to those hospitalization rates are kids and our children and teens. What are those numbers looking like, and what can we do or to help alleviate that?
Yeah, so most kids get over COVID okay. About 5% of kids will have long COVID. Most kids won't have to go to the hospital, but some do. And we've had 7 children die from COVID through the pandemic. We had a couple of, healthy teenagers, essentially healthy teenagers who didn't make it. So very, very sad. And I know of quite a few more who are critically ill in ICU. So, I think we're going to continue to have challenges with our youth. So prevention, though, is the key. For kids. First off, kids 12 and older are eligible for vaccination. So please, if you have a teenager or an adolescent, please get them vaccinated because it's protective. My 18-year-old is vaccinated. My 25-year-old is vaccinated. I feel very strongly about how important that is to keep them safe. But also prevention in schools is important. In Mississippi, local school districts have a lot of autonomy, and we did have a mask mandate last year, but the governor didn't renew it this year. But most schools under our guidance, we have pretty good guidelines that can protect schools from outbreaks, are using masks. So that's good. Most are, but all of them are not. We are starting to see a decline in cases, but we've had thousands and thousands of cases among kids and also teachers, and it's been very disruptive, not only to the health of these folks, but also to the learning environment.
Okay. What can we do for our kids that are under 12 years of age? They can't get the vaccination, but
Not yet. Mm-mm.
Okay.
But prevention's key, right? So we know that, like in a classroom setting, if we have them wearing masks, even if they're not separated by a large distance, we know that the masks work quite nicely, very, very well, and prevent outbreaks. So masking in school is important, doing things outside. So, the same sort of prevention stuff we know works is very important. It's important for folks to remember that we catch COVID indoors around other folks, and if we can, be outdoors, or if we can wear masks indoors, that makes a huge difference.
Great. I kind of want to piggyback off of our healthcare system a little bit. Like I read in an article from Mississippi Today that we're spending $8 million a week for contracted workers, for 1,000 or so, 1,200 contracted workers. What does it look like for the state in regards to funds, in regards to having more healthcare workers come to Mississippi to help? Just because I would say we were number 47 across the U.S. in regards to vaccination rates. So,
yeah, no, you're hitting on a really good point. If we had more folks vaccinated, we wouldn't be in this trouble. Now, the Delta surge was inevitable because it's just really a nasty virus. The Delta strain is really bad, but we wouldn't be seeing this level of hospitalization and death. And that's the key thing, and that's where the vaccines are super effective and helpful. As far as bringing in the staff, we were kind of at a desperate phase. We're still using them, and it's been super useful. We've also pulled down federal resources, including Department of Defense teams and other folks. National Guard have been helping out a little bit, so where they can. So we've got a lot of help coming in from many different quarters. Now, the expenditure, yes, is it money that hopefully we wouldn't have had to spend otherwise? It would have been good, but this money is federal money. It's under the Stafford Act, or basically FEMA. HHS pays for it, so it's not money that's going to have to come out of the state budget.
In regards to our long-term care facilities, we've had close to about 100 or so outbreaks. Are long-term health care facilities also seeing some of the same problems, or they're taking different procedures in regards to their numbers and outbreaks?
The long-term care settings has been a really interesting situation. Most of the cases that we're seeing in long-term care and nursing homes are in employees because they're under-vaccinated. We have seen some deaths in long-term care residents, and some of them are vaccinated. We know that the vaccines, are not quite as good for some of the older folks. And that's why we're talking a lot about the boosters. But, they're starting to get better. Sadly, all the outbreaks that we've seen, it's really unvaccinated employees bringing them in to the center. And, the federal government, the White House, is going to mandate that all nursing home employees get vaccinated. We think that's going to be happening pretty soon. And so that'll be an additional safety measure. But we do have some things in place at the nursing homes that prevent outbreaks and protect. So the amount of outbreaks, deaths among residents is so much less than we've seen during previous waves, because so many of the folks are vaccinated and these preventive measures have been useful.
What's your take on just because mid-August was such a tragic time for Mississippi, and us being labeled as the COVID capital of the world for that period of time. Moving forward, do you see any school closures happening in the near future, or do you think there's a way that I understand that some school districts are operating differently, but as it relates to just getting back to normalcy and going to these events like football games and different things like that, what do you suggest in regards to still staying safe?
So it's a really good question. It's very timely with where we are.
So, schools have been closing and they will continue to close when they have big outbreaks, and that's still going to happen, but hopefully at a lesser rate. That's a school by school sort of decision. We give some guidance, but we don't mandate schools close. That's really a school district decision. As far as like getting back to normal, I think that's important to keep in mind that, we have some tools in our tool shed, right? We have vaccines now. So, all faculty pretty much can be protected, and a lot of kids can be. At the football stadiums outdoors, it's pretty unlikely to transmit COVID outdoors, at least in large numbers, right? You might have somebody sitting next to you in a stadium who can give it to you, but it's not going to be a large outbreak. But, coming and going, in the concession stand or the bathroom, that sort of thing, strongly encourage people to wear masks in that setting, strongly encourage everybody to get vaccinated, and really avoid any indoor gathering. I think it's going to be a little bit more interesting as we get toward basketball season, as more and more folks are indoors. But we haven't seen, we know there's transmission outdoors, but we haven't seen the same sort of outbreaks outdoors that we tend to see in indoor social gatherings.
Something that I've been noticing is that, or also hearing, is that if you get vaccinated, I see some people still not, or they feel like that they're still okay without the mask. But could you emphasize how much more protected the mask would, because the vaccination, you could still, transmit the virus to other people?
Yeah, no, exactly. The vaccine is not perfect. Is it great? Yes. Is it safe? Yes, but it's not perfect. And so some people can catch COVID if they've had the vaccine. But most people who catch COVID who have been vaccinated will do quite well. We have had some breakthrough infections that led to death, but primarily in older folks with weaker immune systems. And it's those people who we really need to advocate for booster shots. And you can get booster shots now if you have a weakened immune system. But yeah, no, it's important because we want to not only protect ourselves, but protect our families. And we know that if you're wearing a mask, we know that it is effective. Let me be very clear. The science is 100% behind the benefit of wearing a mask. They're not harmful. They're not dangerous. The medical quality are a little bit better than the cloth mask, but cloth masks do help a lot. So it is a simple, safe, additional step in addition to other common sense things like space and outdoors, and to the proven benefit of vaccines. If we add masks on top of that, it's going to save additional lives.
In regards to continuing efforts, as a state as a whole, what are some of the things that the Mississippi Department of Health are doing, or some of the ways that we as a community can continue efforts and getting people vaccinated?
Well, spread the word. And if you're vaccinated, let your friends and family know you're vaccinated. If people feel good when they know that, you've been vaccinated, then you're doing great. So I think that's super important. Please know that Plan A needs to be get vaccinated. There are just innumerable places in the state of Mississippi to get vaccinated. Go to vaccine.gov, or you can go to any county health department to get vaccinated. Tons of doctors' offices have vaccines right now. So that's Plan A. But Plan B is if you get COVID, check out getting the antibody treatment. At the COVID hotline at the Department of Health, they can connect you with a center that does monoclonal antibodies. And if you go to msdh.ms.gov/MAB, msdh.ms.gov/MAB, you can find one of the 180 plus locations where we do monoclonal antibody treatment in the state of Mississippi.
And before I let you go, I quickly would like to ask you, could you tell us the difference between getting a booster shot and your vaccination? Yeah. I know some people are like, what's a booster? Do I need a booster? Can I get my booster right after my vaccination?
Yeah. So a booster dose is really just a third dose of what you had before. They're really only advocating for booster doses for Pfizer and Moderna right now. And it's the same thing. It's not a different vaccine. It's the same vaccine. But because we know over time, the immunity can sort of weaken, it basically boosts your immune response. The other thing is, we know for people who are immunocompromised or have weak immune systems, sometimes it takes 3 doses to get them to react and have immunity. So right now, we're really pushing for folks who have weak immune systems to get those booster doses or those 3rd doses. But it's just the same exact vaccine that we've gotten. There's nothing new about the booster. It's not like it's a new vaccine. It just helps reinforce or augment the immune response that you had from the first 2.
Perfect. And then, are there any closing statements or something that you would like to emphasize more on that we didn't necessarily discuss on this call, or something that you would like for us to keep in mind in the rest of Mississippi?
Yeah, we've come through a lot. COVID isn't gone yet, but we'll get through this. Now is the era not of not doing stuff, right? We're not saying you can't, go to the store or all that sort of stuff, or go to work or anything, but it's the era of doing things safely. It's the era of doing things smartly. And so please take those steps that you can protect you and your family. Vaccinate, mask in public, do things outdoors. And if we all did that together, we wouldn't be in the situation we're in. We're going to have other outbreaks and other surges, although I doubt they'll be as bad as Delta unless something dramatically changes. But we know how to get past COVID, and we need to do it together.